We like to keep things holistic, healthy of the mind, the spirit, the soul, right? And that's why we like to keep us updated, keep our community updated on different types of medicine, and more specifically, aesthetics and functional and integrative medicine. Very, very interesting topic we're about to get into right here on the Splash Live. So join us right here from Grover Health and Wellness. Dr. Keshav Grover join us right here on the Splash Live. Thank you so much for your time, Dr. Grover.
Absolutely. Good morning. Thank you so much for having me. I appreciate your time.
Absolutely. So we're talking about something that's a new approach or a different approach to health and wellness, I guess we can say. But I want to kind of first start off just talking about how you feel Grover Health and Wellness integrates traditional medical care with holistic treatments to benefit your patients.
Sure. That's a great question. And so part of a big question we get asked a lot of times is what is functional and integrative medicine?
Mm-hmm.
So functional medicine is figuring out the why something's happening. So in a traditional care model, if you go to your doctor and you have high blood pressure, for example, they'll probably talk to you a little bit about lifestyle alteration, maybe give you a nutrition packet to talk about like having less sodium in your diet, things like that. And then they may even introduce a medication to reduce your blood pressure. And typically speaking, in a traditional medical model, doctors typically don't have the time to sit down and really coach patients on a lifestyle alteration that can help actually lower their blood pressure, as an example. In functional medicine, we go a step further and we say, why is the blood pressure high? And we do a little bit more of investigation with blood work and other kind of testing to say, okay, how can we help this patient out with that issue in terms of, is it their diet, is it their nutrition, is it their nervous system, their hormones? What is it that's going on that's creating that issue to be there? And then with integrative medicine, that is using the best combination of healing modalities that are available and also that are suitable for the patient. And the patient is willing to utilize to help themselves. So, for example, if a medication is part of that from a traditional perspective, then that would be integrated into the plan. If acupuncture and yoga can be part of that picture too, then that would be integrated in the plan amongst other interventions like nutrition, supplementation, herbs, mind body medicine, and so forth. So the functional is really answering the question as to why something is occurring from a biochemical perspective to say, okay, this is the reason why this is happening.
Mm-hmm.
And then the integrative perspective is coming up with the actual treatment approach, utilizing the information that we've gathered, as well as the history taking from the patient. Oftentimes, the patient will tell you what's going on with them.
Right.
You know, that was one of the biggest lessons I learned in medical school from some of the amazing mentors I had was if you talk to a patient in a way that they feel open and can have a high level of trust with you, they will tell you exactly what is going on with their body and inside of themselves.
For sure.
And that's why we give our patients a 60 to 90-minute intake process in our office after doing a discovery call to really see what is it that's going on. Let them kind of feel at home in our office. And that's why we've even designed our office to be kind of a much different clinic, because if you go to a general clinic, most of them feel a little bit sterile. They're a little bit more where the patient may be even in a gown, and they're a little bit kind of in a more exposed setting, versus here we kind of create more of a homey setting where, you know, we sit on chairs at eye to eye level. You know, I rarely wear a white coat because I know that that sometimes can even be intimidating to patients. We want patients to feel like we understand where they're coming from,
Right.
and that we want to be a fly on the wall in their life process. And that's kind of our approach.
Great answer. Great. And that kind of filled in a lot of boxes that I actually had to kind of follow up with that. So this is what I took from what you just explained essentially, right? Our doctors in most traditional hospital institutions and things of that nature, they may, diagnose a certain problem or a situation that we may be going through, and then they'll find a treatment for that possibly. But on your end, Grover Health and Wellness, you're essentially looking for the root of the problem and finding out how you can integrate different medical care procedures into it to kind of, I guess, make it a little bit better on a holistic approach. Is that correct? How I approach that?
I would say that's fair. And one thing that I also want to kind of like highlight is that doctors, wherever they are, whether they're in a employed setting in a hospital, in a private office, in a surgical setting,
Mm-hmm.
every doctor, I believe, or I would hope, wants the best for their patient and would want to figure out exactly what's going on with them and give them the best treatment.
Of
However,
course.
unfortunately, the insurance companies require doctors to typically see many patients to to make money, essentially to make a livelihood, that the amount of time that they have is actually spent more so being more concerned, did I document everything correctly, which is
Mm-hmm.
important, and
Mm-hmm.
then also was everything coded to a way that the insurance company would then say, okay, we will pay for this care for the patient and giving them the appropriate medication, the appropriate procedure that are required. And so there's so much backlog, I should say, back office work that's required to actually provide the care. And so in
I get
our
it.
practice, we actually, we are able to directly to treat our patients because we're not dependent upon the insurance company in that sense. And so that's one of the beauties of our practice is that it's just about the patient and us. And so, and that's the relationship that really should be there. I
Mm-hmm.
think that a lot of times the care that's delivered by doctors is dictated by entities above. That is not really where in the patient's best interest all the time.
And I get
So,
it. And
and
so go ahead. I'm
and I
sorry.
would say that we are very holistic in our approach, and
Mm-hmm.
I'm glad you did address the aesthetics part of things in the beginning because our mission and our practice is to help patients feel and look their best.
Yes.
And we really do believe that your inner well-being and your outer self should be as in sync as possible. And so we're here to help that process out.
Yeah, we talk about that a little bit more often too, especially with May being Mental Health Awareness Month. Definitely connecting the body, the mind, the spirit, all of that intertwined and making sure your space and your energy is in the right place. Completely understand. Join us right now from Grover Health and Wellness, Dr. Keshav Grover, talking about aesthetics and functional and integrative medicine, and specifically how it's beneficial and different from traditional medical care, we should say. So, couple quick questions for you before we got to let you go. Honestly, real quick, can you just explain the process of this individual care and this personalized treatment plan for your patients? You kind of, like you said, you're essentially going in and finding the root of whatever kind of issue that they're experiencing. Talk about going through the process of finding that root and treating that root personally.
Sure. So part of that is that we do have a few different questionnaires that patients have to fill out for us. They
Mm-hmm.
give us information about their medical history, their family history, things like where they work, their toxic exposures, and then also we want to know even their prenatal history in terms of what happened before they were born, because then that gives us a real idea of what their body and mind and spirit has experienced from the point of their conception till the point of where they present to our office. We want that whole picture kind of drawn out. And that's why we do that hour to hour and a half. Sometimes it goes more than that
Okay.
intake a visit. Then we consolidate all that information and say, okay, we rank what are the priority goals for our patients,
Mm-hmm.
and then say, okay, these are the steps that we need to take to order specific testing, whether that's blood work or imaging, or even stool testing, saliva testing, hair testing. I mean, you name it, we can test it in terms of from part of the body. And
Nice.
so then we take all that information, we get some more tests, and then even just based upon their history, and sometimes they're even bringing us lab work and other information because they've done the rounds, they've gone to see their primary care, they've
Mm-hmm.
gone to see this specialist, that
Mm-hmm.
specialist, they've had a surgery potentially, they've had another procedure done. So they're bringing sometimes a binder full of paperwork for us to even go through. So
Right.
then we can start to put together and audit supplements that they may already be on to kind of help consolidate that process, recommend mind body interventions, whether that's even something as simple as gratitude journaling. There's a few different breath works that we recommend as well too
Mm-hmm.
for our patients. Yoga, if applicable, and then we also emphasize their activity as well. If they're able to do things like resistance training, walking every day, making sure that they're hydrating, making sure that they're really
Right.
optimizing their sleep, because that's another part of the picture that is oftentimes overlooked. And then emphasizing community, emphasizing also doing their inner work on a daily basis and making their goals a little bit smaller so that it's not this huge task of, oh my gosh, I have to change my whole life.
Right.
But what
More
is a goal
obtainable.
we can work on
Mm-hmm.
in like the next 2 weeks or the next 4 weeks, and
Correct.
then create that timeline for that patient.
Mm-hmm.
And all of our plans are so specific to that patient that it's not that we have like a Grover protocol where it's just that every patient goes through the same kind of system, because that's kind of more of what the insurance world likes to do in terms of puts everybody into the same system.
Mm.
And you know, you may get it right, you may not get it right with that approach. So with our approach, we really want to make sure that we're catering our plans to our patients, and that's why we do that timeline. It's almost like if you were to get a custom suit made for yourself, or a shirt, or whatever garment you would like. The tailor would take their time to make sure their measurements are to you and your body, and not
Right.
just a general off rack kind of garment that you would wear. So, and that's the way
Good
we
point.
we create our plans for.
No, good
Yeah.
point. Good point. I appreciate that perspective on that. And lastly, before we go, Dr. Grover, for the person that's listening right now, Kegel Harbor, Sylvan Lake,
Mhm.
Orchard Lake, West Bloomfield, listening and wondering why? Why choose Grover Health and Wellness? Specifically to the West Bloomfield community, why should they choose Grover Health and Wellness? Or why is it important?
Well, we have one life to live, and we have one opportunity to do that every day.
Mm-hmm.
And I have gone through my own health and wellness transformation, and I get the challenges that people have. Our team understands it. We aren't here to just prescribe a certain lifestyle. We're here to partner with you. We're here to walk you through each step of the way to make sure that you're getting towards your well being goal. And the one differentiating factor in our practice is that we are able to help that process begin as soon as the patient makes that phone call,
Mm.
where we're beginning that process to get them on their road to well-being. And versus in some other practices, a lot of times they'll just leave with a huge bag of supplements and not a
True.
lot of direction,
True.
or they'll be very much so pigeonholed into one or two areas of well-being, which is fine. There's nothing wrong with that. But at the same time, we are looking at things much more 360 globally, and also not just what's going to make you get like summer body ready.
Mm.
We want you to think about your long-term journey, your longevity, in terms of, are you going to be able to, let's say, walk down the aisle with your daughter if you're a father? Are you going to be able to play with your grandchildren if you're a grandmother
Right.
or a grandfather? If you want to be playing pickleball, I know West Bloomfield is working on some new pickleball courts too. In terms of, if you want to be out there hitting that pickleball, how are you going to keep on doing that? Are you going to be able to pick up a suitcase and put it above your seat in the plane? These are all the things that we want our patients to be able to do. It's not just about, oh, we fixed your cholesterol, or we reduced this level from here to here, or we got you down from this weight to that weight.
Right.
Those are also very important, but our larger perspective is, are we enabling our patients? Are we providing them the resources and tools to achieve all of their longevity goals? And
Absolutely.
that's why I think patients should choose our practice for their health and wellness.
Perfect.
And also, I'm very honest. If there's another practice that we think is better for a patient based upon the issues that are coming to us,
That's real.
that I will recommend them to go there, and so will our teammate members, because we want what's in the best interest of our patients,
Right.
or any individual for that
Right.
matter.
Well said, doctor. And I'm glad I gave you the opportunity to explain that to the greater West Bloomfield community of why they should pay you a visit. Once again, joining us from Grover Health and Wellness, Dr. Keshav Grover. Thank you so much for your time right here on the Splash Live. We appreciate you.
Thank you. Thank you for the opportunity.